So it's even more exciting. But I want to bring in Dr. Colon in because he is an expert on this horrible epidemic of overdose, opioids, substance use disorder, and mental health. And he's an expert at the trauma, and we are so filled with trauma, are we not? And also with children. He's always encouraging me to reach younger and younger and younger and younger children. So I'm happy to have you all together so that you can glean some information off of each other, some wisdom, sharing some new strategies, and how we, as the adults here, I guess, because you guys are still young for 3 years until you follow that other thing. Pero, so Dr. Colón, por favor, usted puede.
Sure, no, thank you.
Clase.
I think no, I think they are making a great job. I think that and I agree with you guys. If we want to make a change, you need to come from different faces and different backgrounds. I like what Ryan said. I mean, maybe Carlos or someone was not Puerto Rican, but we're from the same team. We want the same goal, and that's what we need, right? When we work with opioid disorders or any mental health. I work for a nonprofit, for example, but I need, private institutions. I need politicians. I need people on the ground. It's a teamwork, and if we don't create coalitions or collaborative agreements and collaborations, and we work together, we will not see a change. What we're seeing in mental health, the crisis is a public health crisis, and we need to do different changes in different levels, and without the help of different nonprofit, states or local state, also the federal government, we are not going to move. But we need advocates. We need people, on the ground, and create opportunities. That's what we're missing, right? In America, yes, there's great opportunities, but if you don't know about them, right, people don't talk about them. If you don't know the doors that can be open or close, we would not move forward. So I'm open for any questions. I'm here to learn from you guys, and let's do this together. And anything I can help, and anything that you guys can help us. I think that we're here in the same, looking for the same goal, which is helping our communities.
Okay, I'm in. All right, I'm in. Yeah, so I just I think this is a really heavy topic, and I know me just being personally, I think that there's working in our school system and working with within city government structures, but then again just community youth work. This is of course an issue that's impacting our young folks, right? And at a higher rate than what I remember as being a young person. And I think the access to the these opioids, that a lot of young folks don't know exactly what it is that they're putting into their bodies and the ramifications that could come about from it. And I think I hear the term accidental overdose more and more often, and I think from we see it to a lot of the young the young artists or the young folks in pop culture that a lot of our young people look up to, and we see that that there's an even more of a we see a lot of our young rappers or our young artists that are also partaking in this and having some of the accidental overdoses that come from the opioid use. And so from a youth work lens and working with young folks, I think some of the things that we struggle with is to help get them to the root of what it is that is actually needed, right? And that is why are we self-medicating, right? And having those conversations as a non-licensed person that is not a medical professional, right? And these are constantly the conversations that we're having day in and day out on the ground doing this work. And so really curious, how do we start like from like, you know, people that do this work on the ground 50, 60 hours a week, like how do we get access to these same resources, you know, that it's like, you know, like identifying like, you know, that our young folks have not had adequate access to, you know, health coverage, you know, haven't had adequate access to, you know, the education that's going to give them the information they need. So like maybe like starting there could be you know, get right down to it, get down to the roots of it, because like that's essentially where a lot of this stems from. So I'm curious what thoughts that we could have in that space.
Can I say something, Papito?
Please, this is a conversation. Let's do it.
Yeah. First of all, it's super that all of you are representing. I want to say que lindo to see all of you here. And I want to share with you some cultural stuff that I want to put into the mix. When I was born in Puerto Rico, and then I moved to the South Bronx, and I remember that every time something would go on with health, people would say, ¿Qué te dio el doctor? What did the doctor give you? ¿Te dio una inyección? ¿Qué te recetó? What did he prescribe for you? And I think that as I look at the older generation, I go to their homes and they have a pharmacy, straight up, a pharmacy in their home, believing that the medical profession is going to give them alleviation. Entonces, you know, that's one thing. I think culturally, we have bought into the pill or whatever it is that's going to have you relax, which means, and I come from the culture of, you know, the heroin addicts in the South Bronx, the methadone addicts in the South Bronx. Entonces, pues, you know, you want something to help you relax. So it says something about how are we living and what's our lifestyle that forces people to look for relaxation. Entonces, the other thing it produces is sort of like a happy, tú sabes. So how is our culture taking away the joy of being young? You know, what is the stresses that the young people are going through? Because I think that's what we have to look at to remedy and look at the opioid epidemic, because what many people are doing is, what can I take to make me feel better? What can I take to make me feel relaxed? And then it eventually leads to a heavy addiction. So I don't know where the conversation will go as far as that's concerned, but as a pastor, that's what I noticed, that just the mental state of many people seeks to have something that will make them feel more relaxed and better about themselves. That's it. Thank you for listening. Papito, you look just like my cousins too.
No, I think that's like definitely like a reality, right? And I think like something that like I was like writing down, like, or something that I continue to just keep writing down is like what you all shared at the beginning, and it's like how is the system then created like these generations of trauma, right? That like we're continuing to be within the cycle of trauma. And so we're medicating ourselves, right? To say like, oh, actually this can make it a little bit easier for this moment, and not knowing the repercussions that it could then translate into, right? As like generating that addiction. And it only takes one time, right? For somebody to be like, I want to replicate what that is. And for young folks who haven't had like full brain development yet, right? Like knowing that like that it's going to be, they're even more susceptible to it, and there's even more access to it. You know, the street drugs, that it's easier to get access to street drugs than it is to get a doctor's appointment, you know, in a lot of places. And that's, I think, a lot of, or you know, from the conversations I have with young folks, like, I mean, it's a reality.
Yeah.
Something I want to add on to this is, and we talked about, or Carmen brought up the thinking about a rural lens as well, or a greater Minnesota lens. And just that, you know, at Copal, for example, we have an office in Mankato, and then we also have staff in Rochester. And the reason that Mankato office was opened was because all these resources that are available, even though our community is still suffering in the metro, you know, and then we're facing all these problems in Minneapolis and St. Paul. If you can imagine as well, what the implication is of when there's not even that support structure. There isn't the West Side boosters. There isn't access to various nonprofit or governmental resources, and it's just so much more challenging. We established the office in Mankato because there was no one else filling the need in certain spaces for access to vaccination, access to masks, right? And so that is just doubled when you're in an area, or tripled in an area. And you're seeing as well with the white population that the opioid crisis and all these other crises are really deeply impacting rural communities and greater Minnesota communities. And it's the same for our gente, that just like the lack of resources is even doubly felt. I see me. Yeah.
I'm sorry, I didn't mean to cut you off, Ryan, but I think one of the things that I reflect on as we've had this conversation is that like our healthcare system, similarly to our education system, is very white centric, and it doesn't value community as the solution to our challenges that exist. It's just like our like how the system and structures and has institutions that set itself up. It's like white aspiring, as opposed to really seeing the assets of our Black, Brown, and Indigenous communities, our Latino communities, and lifting up the wisdom and lifting up the traditions and lifting up the experience of our elders as part of solutions to education issues, to healthcare issues, because like it's always, well, what does the white person, what the paper degrees say? And so as a person with a master's degree in public administration, I'm not going to pretend that I know what my students want, what my students need, just because I'm brown and just because I'm Latina. Like, investing in relationships, investing in people, talking to people, like, our systems can spend millions of dollars on whatever plans, communications, whatever it looks like, but do they know, like, where do our young people in St. Cloud and Rochester like to hang out? Like, what do they like to eat? Where do they like to spend their time? Who are their friends? And I think, like, for me in my work, like going through an experience and building a framework that, we talked to Ryan, you were actually part of one. Focus groups on like, what do you identify as important in school success and student success? Because like we are not going to accept the narrative now that like our kids are failing, right? Or that we are disproportionately addicted to opioids or drugs or chemical dependent. Like, we have the skills, knowledge, and attitudes needed. And we just have to take our control back.
I see Dr. Fiol has a hand up.
Okay, hello, I'm here. All right. So I'm very happy to be here. Thank you, Carmen, for inviting me, and congratulations to the Sofrio Squad. I've really been looking forward to this conversation today, and I like what Reverend Mercado said too. Because I'm going to invite you right away for a place where you can talk about what you're seeing, this problem in our society. Because I think that a lot of people out there don't know about your resource. We have a Hispanic, or it should be Festival de la America activity that we're sponsoring through the university. I'm with the University of Minnesota. I'm a neurologist there and a longtime friend of Carmen. And there is a Festival of the America on September the 10th at St. Nicholas Church in Bridgefield. And I want you to invite and bring a table with information and mostly talk to people. Because what I see out in the community, we have community programs that we do, is that people don't know what to do with this problem. This gets brought to me a lot. We have a kid who's young, he's into alcohol and drugs. What do we do about it? So where do they go for service? Some of them are immigrants too. Some of them don't have medical insurance. Where do they go to for getting somebody to talk to who can counsel them? I think if you come out to our community you'll be welcome very, very much. And then you can talk about a place where people can go to deal with this issue, because what I hear, it's pretty significant problem, but a lot of people don't know what to do about it. So thank you for putting this together, but please join us on September 10th. Thank you very much.
Thank you, thank you, Dr. Fiol. Dr. Fiol is our very valuable elder here in our community. And I've been wanting him to meet Dr. Hector Colon Rivera for so long. So I'm so happy to see you both on the screen together. Por fin, los dos paisanos de Puerto Rico. And Dr. Hector is from Vieques, which is the sister island of Puerto Rico.
Right.
And these two gentlemen are forces to be reckoned with. And they are so wonderful and inclusive and helping our community. So I just needed to take that second and thank Dr. Fiol and introduce you to Dr. Hector, y así en el futuro para hacer algo. And we could do it in Puerto Rico. We can go to Puerto Rico and do this.
No, it's a pleasure. And I just want to say that we need collaboration like this. We need collaboration, different generation, different collaboration, different states. I just want to say that people use drugs, just coming back to the topic about drugs, for different reasons. Not only to self-medicate themselves, but I mean, if we talk about research and we talk about data, I mean, there are usually 4 or 5 reasons that research show that people use drugs because of those reasons. So one is to feel good. We know that people like to feel good, to feel better if they're not doing good, to do better, which is the performance, right? The kids that use the Adderalls, the stimulants. Some people use drugs because they're experimenting. I mean, just curiosity, right? They're curious about any effect of the drugs or how they affect them. Peer pressure is another one that's big on the top, and experimenting. So experimenting, peer pressure are on the top right now in terms of adolescents and kids. We need to be careful because using drugs doesn't mean you have a substance use disorder, right? I mean, some people use drugs and they just use it and keep going. I mean, but what we want to talk is about, we need to prevent that when a use becomes, experimenting with something becomes an abuse and then becomes to a dependency and transforms to a substance use disorder. That's when the functionality of that person is affected. And we see that, right? The symptoms of substance use disorder is when we have an impaired control, we start having social problems, we have a risky use, and when we have the drug effect, which are divided into the tolerance, which is using more than we intended or using more to get the same effect that we had before, and the withdrawal symptoms, which is what happened when we don't have the drug, right? That's what we look when we're talking about substance disorder. In terms of the system, right, what we're doing for our kids and adolescents, so especially Hispanic, right, or people mention the brown. So I don't think we're doing enough. I mean, and the fact is, like, we don't have the workforce, we don't have the war system, right? I mean, when we talk about, we call Hispanic minorities, even though, I mean, we're still minorities. Well, our population is increasing crazily. I mean, it's like in Philadelphia, we are about 16% now Hispanic. I mean, that's a lot of people. But guess our workforce is about probably 2%. So the mismatch, we're not recruiting enough people. We're not retaining enough people. We're not doing enough in college. We're not doing enough in high school. There's some pipelines projects out there that people, I mean, some institutions like the American Psychiatric Association are doing that. We're trying to get kids from high school and train them, to be professionals in the future, right? Being psychiatry to treat Hispanics, but it's not enough. So having conversations like this, I mean, it makes me, it give me a mix of emotions because I'm biased. I wear different hats, but but also give me the energy of keep going. I mean, keep moving forward, because I mean, we need this energy to work together, and this synergistic energy to mix our emotions and get some force and move forward and do something, because what we're doing is not enough. I mean, that's the conclusion. We're not doing enough, and maybe working together we can get that that movement happening. And I agree, we need more Hispanics in leadership positions, and we need more projects, more opportunities for our kids. I'm in the I'm the medical director for a nonprofit, and 85% of our patients are Hispanic. We just got a grant to see undocumented immigrants that don't have insurance, so I'm going to start seeing that those people that need the treatment, that don't have insurance, and they're afraid of getting insurance because of immigration status, not having the paperwork, being sent back if they look for help. So we have the money to do that now. We're going to start doing it, but in the meantime we need to work together to get that.
Okay.
Can I just comment that I think, but from the Minnesota context, Dr. Colon Rivera, somebody, you can correct me, there was, I want to say $8 billion that was the state's surplus after this last budget cycle, and the legislature and the governor walked away. And you can talk about political posturing and all of those things, but when this is one of the most egregious states in terms of health disparities, in terms of educational disparities, I think the not doing enough comes from institutions and comes from complacency and not investing in community. Like the Minnesota nice stuff, when we're talking about the disparities, we're going to say that this is a progressive state, but when you're looking at and how disparate it looks like in various measures, it speaks to just the lack of investments of the institutions in the communities. Community is prevention. When you're looking at our community health workers, particularly in my organization, they have the relationships with people. They know who they are. They know what they need. They know what the issues are. And the lack of not doing enough comes from the lack of investment of the institutions with money, but also organizations that have the money. So I just wanted to make sure I added that.
I see a hand up from R. Hansen.
Hola, soy Roberto. I'm director of Almas at Two Rivers High School. I want to bring just everything back, because this group, we have Hector Colon, we have all these people, and we have many people also part of this, that I think what's important would be to come along with some sort of message that have a united front that each one of us can bring to our communities, to bring to the youth in our communities, and get that message to them, to also get that message out to their communities. Those of us that work with youth, we can use these youth as the messengers if we can give them a united message. The same with the social workers, the same with all these people that we know that work directly with youth and with families. If we can get this message, again, a united message from Dr. Colon, as well as all the experts that bring that forward, I think that would be the most beneficial thing. We've seen that with tobacco, where we've been able to do that. We're getting that with vaping now, and we're starting to get that. I believe that would be the most beneficial thing that we can do against opioids as well. Thank you.
I'll add that while I might not have the message, but what you did hit upon also was that how key young people are, and obviously that's a theme of this panel. But what I will say is that in Minnesota, there's an interesting thing when we're talking about our Latino community, which is the kind of the nature of it in Minnesota is not the same as in every other state. And so thinking about the population went from the 90s of 1% to now 5 or 6% in Minnesota. And so we're not thinking about necessarily 3, 4, 5 generations for the most part. I mean, the Francos have been here since the beginning. They went to the West Side community very early on, but you have pretty much two distinct generations of Latinos in Minnesota. You have a first generation that is, primarily Spanish speaking, is the older generation. Then you have a second generation that is more or less bilingual. Obviously, we're oversimplifying, but the youth have been such a key piece of being able to be cultural messengers, to be language messengers. And that's, really magnified in Minnesota's population. So the investment in young people specifically to be the messengers for their families and communities is really something that could be key. Also, I see hand up from Rosita.
Hi, Rosita.
Oh, es que, discúlpame,
De
Ryan,
verdad.
your voice got cut it, so I don't know if my internet is flaky or what. Thank you very much for this conversation. I am so happy to see my beautiful secret Amore, Al McFarlane there, and my beautiful
Thank
friend
you.
Carmen. And I am happy that you invite this old person to this meeting. One of the things that I could notice in most of the programs that want to tackle, I don't want to say a problem, a situation in our communities, mental health, anything, COVID, anything, is the lack of investment in prevention. And the prevention should not be only like educate the kids about what opioids are or why is wrong or bad, but actually they should invest and put a lot of money in activities that youth like. Give every single kid a membership to a gym. Give every single kid tickets for concerts. Teach them how to play instruments, things that they love and enjoy. They will find happiness in those activities also. In our Latino community, I had in many occasions long discussions with parents, mothers, fathers. Oh no, my daughter shouldn't be doing, ¿cómo se dice? Fútbol americano, American football. My daughter shouldn't because she's going to her muscles, her back. Who cares? She wants to do it. Let her. The boy shouldn't be playing a violin. No, he wants to do it. Let's do it. Let's find the scholarships. Let's give opportunity to every kid to enjoy activities outside of school setting. I think that is very key, very important. Universities do a lot of summer camps. Our kids don't participate because there is no transportation. The parents don't know. There's so many things. And it's like, come on, guys, you institutions, universities, schools, Department of Health, everybody should put their heads together and create like a big fund for our communities to have access to all of those activities. I'm telling you, if this happens, a lot of the sad things that occur with our kids will go down. That's Rosita, a mother, an educator, an advocate experience, because I have helped a lot of kids, a lot of families that right now I have students that are rowers, swimmers, all kind of sports that they do, and they could be doing other things. So they make other choices because they have more options. And I don't know what you think of that, Dr. Colon.
I do agree in terms of the prevention, but I think America teach us professionals, right, to treat but not to prevent, and we invest a lot of money in treatment but not on preventing something. So we get really good, treating something, but not we don't see it before it happens. And I think that's we miss a lot of, I mean, we have a lot of missed opportunities. I do agree that we need to create more investments in activities. I mean, those activities has to be sustainable, cannot be random. And I agree with Samantha comment that not every community is the same, and every county, even every county in Minnesota, is not the same. The way they speak, the way they move, the way they dress is different. So their needs are different. And we need to have that in mind. I mean, I think I don't want to talk about politics, but I mean, I always voting is the most important right you guys have, and we all have the same right. And we need to, yes, give the voice to the adolescents and the new generations, but we all need to get our voice in the voting process and select the people that we believe are going to represent us the best. Because if that doesn't happen, I mean, it doesn't matter how much we talk or we plan. I mean, we're not going to move. We need to get that voting process, and don't be afraid of running for positions either. I mean, we need more of us running for leadership positions. I'm just going to mention something about the opioid settlement, because I know Minnesota got a lot of money on the settlement for the Johnson & Johnson, Purdue pharmacies, and other institution. And this settlement happened not that long ago. So I'm not sure how they're going to split the money. I believe it's more than 300 million. It's about that. So maybe someone from the state can talk a little bit about where that money is going to be divided. And I think that's a good way that we can work and kind of advocate for some of that money to go to prevention or educational activities or schools. And because that bucket of money was divided between two, I mean, is all states are getting something. So it's a definite money. I mean, you are gonna get that money. Now, who decide how they're gonna spread it? I think you guys have a voice on that too. So just want to mention that. Just an example of how we can make a change.
I see that hand from Jesse.
Hi, yeah, thank you. Dr. Colon, you brought up a great point, and I had my hand up. I work with Ramsey County Public Health, and I'm actually the opioid prevention coordinator. And in regards to the money that you just talked about, that money is coming through public health. And I am so happy to be on this call because I am actually going to be responsible for some of this money and how we get it out to communities. And as I heard somebody mention a little while ago, prevention. We don't do enough of prevention. And I really want to have further conversations with all of you if I can, because we have an opportunity to actually frame how we want this money is spent. And if we have these opportunities, and I get an opportunity to speak with you, all either separately or together, we can make this money work for us in our community. And Dr. Colon, you brought up a real big point. This is $300 million that's going to be within the state of Ramsey County only for the next 18 years, not to count out the money that Walgreens is going to be paying as well. So we have maybe 4 different pots of money that are going to be coming our direction within the next few months. And I'm going to say I feel really honored to be able to work with you guys in how we can use this money to help our communities. So I'm hoping to have more contact with not one, with maybe all of you. So thank you.
I just want to share that, Samantha, Carlo, and I have a little text chat, and the second you said that, I was thinking, Carlo, well, he's in Ramsey, he's doing the West Side Boosters there as a project, and how much that could connect to those resources. So it's just that idea of that's what we're in this movement for. Of it's not just like, I'm not thinking about the opportunities for my organization, for example, but I have so many contacts. We have people like Carlo that can be stepping up for that. So it's just those connections. I see we're approaching 4 o'clock as the end time. Carmen Robles, do you want to do like a closeout?
Yes, yes. Thank you all for this wonderful conversation. Dr. Colón, como siempre, gracias por su presencia y por su apoyo, porque eso nos ayuda con la gente que hacen las decisiones. And so, you know, you give us that approval, and I appreciate it. Jesse, thank you so much. I can't wait to call you. So we've done shows with Representative Dave Baker, who's the one that penned all of this and has worked with his heart, as has Senator Eaton. And so we invited them into our show, and we've had those conversations. And DHS is there for us all the time, and especially now that can be supported with dollars. So I am excited about prevention. Mr. Hansen, that's what he's all about, is prevention. With the youngsters turning into advocates of health, jóvenes de salud, where they go and they did it in tobacco. They kicked the tobacco industry out of Cinco de Mayo parade. And so there's a lot of power there. We have to close out the show because of time, and I want to send it over to my right-hand person, Paulina. Muchísimas gracias for joining us. And everyone, our audience, thank you for your comments. We're going to get back to you. We're going to grow from this. And again, ORN, DHS, and all our supporters, thank you very, very much. Paulina, por favor.
Well, thank you, everyone. Thank you, Sofrio Squad. Thank you, Ryan, Sam, Carlo, Dr. Hector Colón Rivera, Jesse, everyone who has participated in this important event. Thank you, Carmen, for the information, for organizing everything. I think everything well went. We are gonna send you by email a feedback survey. If you could answer it, we will be very pleased. And thank you, everyone, again for being here.
And one more thing, on September, we're going to be doing our show. It will be on the workplace, and it will be about what Dr. Colón just mentioned, you know, the 2% in the workforce, and how do we bring up those numbers. So you will each be invited to September 22nd. I look forward to rejoining all of you. I wish you a blessed, happy, wonderful day. Don't forget to register, and adios. Terminamos, mi amor.
Thank you.